Thanks for inviting me over for a cookout, Eric. With Judy in Minnesota visiting our daughter, this sure beats my leftover pizza.
Well, Keith, I don't usually fire up the grill just for the two of us. We're happy to rescue you from your own cooking. And in return, I get to grill you about your Medicare plan. We have decisions to make of our own.
Well, I don't mind getting a great meal and getting grilled. My Medicare plan works great for me, and I'm sure it'll work just as great for you and Ann.
Everything's ready inside. How are the brats coming?
Brats are done. Grab the platter. Let's go inside.
There's no doubt Medicare is great healthcare coverage, but it's also complicated. For the next few minutes, I'll help you gain a better understanding of Medicare in general, and I'll talk about the Medicare coverage you can get from Security Health Plan. But first, here's a bit of information about Security Health Plan.
Security Health Plan is a not-for-profit health maintenance organization based in Marshfield, Wisconsin for more than 50 years. But more than healthcare coverage, Security Health Plan is a leader in supporting health for our members and communities. We also make charitable contributions that respond to some of the most basic needs in the communities we serve. Security supports organizations that save lives when they respond to financial burdens, food insecurity, shelter needs, mental health, substance abuse, and public safety. Security Health Plan enriches lives in Wisconsin through the programs and people we support. As your neighbors, we share your values and understand your needs. And yes, we offer great health coverage.
This might be the first time you can enroll in a Medicare plan, or you might be thinking about switching your plan. But what is the right choice for your lifestyle and budget? That's what I'm here to help you understand. I think you'll find that Security Health Plan has a Medicare plan that's right for you. Let's start by covering some Medicare basics.
Wow, what a spread. My mouth is watering already.
Well, thanks, Keith. Grab a plate and dig in. Hey, Keith, I'm sure Eric told you we have an ulterior motive for inviting you here today.
Yeah, I don't mind being grilled and getting a good meal out of it.
Well, we're getting close to retirement and we need your help. We don't know much about Medicare or Medicare plans. And you have a Medicare plan you really like, don't you?
Yes, I do. But first, have you heard about the different parts of Medicare? A, B, C, and D.
Well, I know a little bit about the Medicare parts from some ads I've seen on TV. Medicare Part A is for when you're in the hospital, and Part B is when you go see the doctor.
Right, Parts A and B together are what's called Original Medicare.
When you only have Original Medicare, Parts A and B, you are responsible for the remainder of the costs for all of these services, including large deductibles and co-insurance. And you should note that Medicare has no limits for how much you will have to pay out of pocket in a year. This is where Medicare supplement plans come into play. You still have Original Medicare Parts A and B, but the supplement plan helps pay for the deductibles, co-payments, and co-insurance. Security Health Plan offers a supplement plan that will protect you against high healthcare costs. There are two more parts to Medicare, Part C and D. Medicare Part C is commonly known as Medicare Advantage. Medicare Advantage plans replace Original Medicare by covering Part A and Part B services. Finally, Medicare Part D is Medicare's prescription drug coverage.
There are several ways to receive Part D coverage. You can have a standalone Part D drug plan or a plan such as Wisconsin Senior Care to match with a Medicare supplement plan.
I'm gonna get you! Stop chasing your sister!
Making things better is kind of your thing.
Right up. There you go, good.
But when Medicare has you stumped, it's hard to know how to make it better.
Maybe I can help.
Security Health Plan. Medicare coverage you want, value you need, service you love.
Let's talk about the Medicare plan available in your area from Security Health Plan. Before we look at plan specifics, I should mention that Security Health Plan's Medicare plans are available only to residents of Wisconsin.
I know somebody that likes his Medicare supplement plan. I think it's through Security Health Plan.
That very well could be. Security offers a Medicare supplement that saves money on healthcare costs and includes some extra benefits. I checked it out, and there are some good reasons to consider a supplement.
The Security Health Plan option offered in your county is a Medicare supplement that protects you from the high costs of original Medicare. Here's how a Medicare supplement plan works. You still have original Medicare Parts A and B, but our supplement plan helps pay for Medicare's deductibles, co-payments, and co-insurance. You pay the monthly premium, and Security Health Plan pays most of your remaining health care costs. You can see any Medicare certified provider in the United States that has not opted out of Medicare. You can also add riders to give yourself even more coverage. Let's dig deeper. Security's Medicare Supplement Plan includes optional riders that allow you to choose your premiums and out-of-pocket levels to fit your personal and financial needs. First up is the Part A Deductible rider.
This rider protects you from Medicare's hospital deductible, which is currently $1,556 each benefit period. What's a benefit period? Here's an example. After you leave the hospital and have not received skilled nursing care for 60 straight days, that marks the beginning of a new benefit period. As you can see, it's possible you could have several of these benefit periods in a single year. Next, the Part B Excess Charges rider. This rider is valuable if you use a provider that does not accept Medicare assignment. Security Health Plan will pay the difference between what Medicare pays and what your provider charges. The additional home health care rider. This rider guarantees you will be covered for home health care for an aggregate of 365 visits per policy year as required by Wisconsin law. It adds some coverage for home health care that is not covered by Medicare. However, because Medicare pays for the majority of home health care services, this rider may not substantially broaden coverage. Then there's the Foreign Travel Emergency Rider. After you pay a $250 deductible, Security will pay 80% for emergency medical care received outside of the U.S. Care must occur during the first 60 days of the trip, and there's a lifetime limit of $50,000. Finally, there's the Medicare Part B copayment or coinsurance rider. This rider is a little different. With all the other riders, you pay an additional premium to avoid charges. This rider is sort of the reverse of that. With it, you can reduce your premium by agreeing to pay some charges that your supplement policy would otherwise cover, things like a $20 copayment for office visits or a $50 copayment for emergency room visits.
Here are 5 reasons to consider a Medicare supplement from Security Health Plan.
1. You get an added benefit of our $30 per quarter benefit for over-the-counter health products. 2. There is no provider network. You can see any Medicare certified provider in the U.S. that is not opted out of Medicare. 3. Competitive premiums. Plus, there is no application fee to apply for coverage. Medicare supplement premiums increase as you age, however, so it's wise to review your Medicare options every year. 4. Guaranteed availability. Security Health Plan's Medicare supplement is available to all Medicare-eligible Wisconsin residents, and once you have it, you cannot be canceled or charged more than anyone else your age because you develop costly health problems. 5. Unlimited preventive care. Medicare mandates free access to most preventive health care. Security Health Plan takes that a step further by paying 100% for most annual physicals, preventive tests, and services that are not covered by Medicare. And there is no cap on this benefit. Other health plans commonly limit this benefit to $250 per year. Again, Security Health Plan works to keep its members as healthy as possible.
Wow, Keith, thanks for all the great information about Medicare. I, for one, feel a lot smarter about our future healthcare costs.
I agree. And by the way, when are we able to sign up for Medicare plans?
Well, the short answer is when you turn 65. But as you get closer to 65, you'll get information from Social Security and Medicare. That's also a good time to start looking seriously at Medicare plans.
There are 2 situations when you are guaranteed eligible for Security Health Plan's Medicare supplement coverage. The first is the Medicare supplement open enrollment period.
If you enroll during the Medicare Supplement Open Enrollment Period, you're guaranteed coverage. The Open Enrollment Period lasts 6 consecutive calendar months. It begins with the month you were first enrolled in Medicare Part B, or the month in which you turned age 65 if you were first enrolled in Medicare Part B for certain health reasons. The second situation is the Special Enrollment Period, which can occur if you have lost or are losing other health insurance coverage, such as an employer or retiree plan. You will receive a notice from your prior insurer saying you're eligible for guaranteed acceptance into a Medicare supplement policy. Enrollments outside the open or special enrollment period may be subject to medical underwriting.
One last thing. When we get to the point of choosing our Medicare plans, what do we do?
You can call Security. They'll answer your questions and help you feel confident you're on target with the plans that are right for each one of you. They'll connect you with an agent and get you signed up for your plans. Or just make an appointment with any local insurance agent who sells Security Health Plans, Medicare plans.
I hope we've shown you today that we put our members first. We do that because we really do care. We're not some national company with a headquarters halfway across the country. We're local. We're right here where you live.
When you call with questions, your calls will go to our friendly, award-winning customer service professionals and benefits specialists who will answer your questions and get you the help you need. You are our neighbors, our friends, our family. Doing right by you is what we're all about.
Well, this has been really nice to get together. Great food, great friends, and I hope I've given you some great information. Thanks so much for lunch. This is the best meal I've had all week.
Well, and you're always welcome to come over and enjoy some good home cooking when Judy's out of town.
But next time, let's all 4 of us make it a date. And Keith, we are definitely going to call Security Health Plan when the time comes around.
Do that. You'll be very satisfied with your Medicare plan from Security Health Plan. I know I am.
To sign up for Medicare coverage with Security Health Plan, simply call the number below or visit our website for more information.
Security Health Plan's Medicare plans are available only to Wisconsin residents. While we offer Medicare Advantage HMO point-of-service plans in many Wisconsin counties, our Medicare Supplement plan is available everywhere in the state. Please call our sales department at 1-877-909-1045 to learn more. Thank you.
I'm gonna get you! Stop chasing your sister!
Making things better is kind of your thing.
Fire up. There you go, kid.
But when Medicare has you stumped, it's hard to know how to make it better.
Maybe I can help.
Security Health Plan. Medicare coverage you want, value you need, service you love.